Those like ADHD, autism, learning disorders, then something that's not so common called Tourette syndrome, which have a origin in genetics and in inherited, but they persist to adulthood. That's the thing. So they are of interest to all of us, especially if you have children. So let's jump in. What is terahertz? Terahertz radiation lies in the electromagnetic spectrum. And electromagnetic spectrum is the range of waves from radio waves, visible light to X-rays and so forth. And terahertz is between what is known as the microwave as well as the infrared range there. And if you have a penchant for mathematics, it's 0.110 times 10 to the power of 12. That's 1 trillion. What is it used for? Well, originally it was primarily used for telecommunication where they exceed microwave. I'll talk more about that. If you have a 5G phone, you're using microwave. 6G phones that are coming use terahertz. Yes, so it's new. Now, the interesting thing is that almost every molecule has a fingerprint, give out waves that are indeed terahertz frequency range. So it is very interesting from that regard. So this is the entire length of the electromagnetic spectrum. Very short wavelength include X-rays, ultraviolet, things like that. These are harmful to the body. The visible light, this narrow stripe, all the 7 colors of the rainbow, microwave and radio wave. Terahertz is in between. Okay, so the frequency is about 30 micrometer to 3000. So what's so important about terahertz? Well, there's a breakthrough in the 1990s where we began to develop techniques for studying, for generating and monitoring and detecting terahertz waves. Before that, we don't have. It can detect concealed objects, identify objects in flowing pipes. In 2011, a very interesting finding, terahertz was used to look at a painting, and in the past painting used to be painted over, painting after painting painted over, and uncover a painting beneath with the hidden name of the artist. So this is an interesting finding and tells us what terahertz is able to do. Now it's used in many fields to look at things. For example, in archaeology, you can see what is inside without digging out and messing with all things. So it is non-ionizing and is used to study human body, active as well as passive. Passive means you shine terahertz waves on the body. It's active in the sense that your body also produces terahertz waves. And people who do qigong will have experienced this. You actually can feel the terahertz wave. So why we know so little about terahertz is because of what is known as the terahertz gap. Waves on this side used to be studied under electronics, radio waves and all that. And waves to this side was studied under, because this is visible light. So we use photonics study. Photonics is the study of light. So here is in between. People do not know how to study it. Now terahertz has been studied using photonics. China especially is one of the leading places where this is studied. But it's studied all over the world, including in Singapore, in the universities here, they have produced papers on terahertz. Applications of terahertz, as I said earlier, in telecommunications. 5G phones is microwave basically, 6G is terahertz. So because it can see through things, it's very useful for military and security purposes. It's also used in agriculture where you can see inside plastics, textile, paper and so forth. And in agriculture, for example, you can monitor whether there's a drought coming by looking at the leaves, and terahertz can detect the amount of moisture in the leaf decreasing and hence a drought is coming. In health and science, it's non-ionizing. Unlike ultraviolet rays and X-rays, it doesn't cause your cells to mutate. As a result, it can be used in medical science and it resonates at cellular frequency. So terahertz has been called the light of light. So the 2 applications in medical science for diagnostic devices, and this is one of the areas that we research. Use it as diagnosis. You can see different layers even in on the X-ray on the bone. You can see different layers. But I'll be talking mainly about how we use it to help ourselves as therapy devices. Where did the healing property of terahertz come from? There are 2 aspects. One is the heat. We know that infrared is healing. People go to infrared sauna and they get better for various reasons. So one property of terahertz is the heat. It can penetrate, it can push out toxins and so forth. But another aspect that cause healing is a vibrational. So scientists have separated these two aspects by taking out the heat element, and in one of the devices, the Pro version, you can have the TeraHeartz wave, the cold version. So the cold version, there's no heat, there's only the vibration, and that vibration also can have effect, indicating that it is a vibration that sometimes cause healing. So this is as important as that, and that's the difference between TeraHeartz. TeraHeartz is far infrared. Infrared, you have near infrared, mid infrared, and far infrared. And far infrared is much more potent for healing than near infrared, the usual infrared that we know about. So for the purpose of healing, TeraHeartz has many properties. It is non-ionizing. That means it doesn't cause your cells to mutate or cause additional problems to yourself. It penetrates through material with dielectric property. What it means is that dielectric property are non-conductors. Anything that doesn't conduct, wood, cloth, plastic, things like that, most things in this room are non-conductors. So it can penetrate through. So you can wear your clothes and you can blow and it will penetrate into you. It is absorbed by polar compounds. Polar compounds are conductors of electricity, such as water, metal, things like that. And the energy in TeraHeartz corresponds to what is known as hydrogen bond, van der Waals forces. Very big forces that hold your protein molecules together. And because it can penetrate, because the energy is very low, and because the kind of forces is equivalent to the kind of forces that bind molecules together, it can change the shape of molecule. That's the interesting characteristic of it. And then the other thing is that our human cell resonate at that frequency. You know that everything has a resonance rate, including objects, all kinds of objects, resonance rate. And our human cells resonate at TeraHeartz. So it regulates biological systems by changing the interaction of neurotransmitters and receptors. So that's how it can have that effect on us. Now, to summarize briefly, TeraHeartz has these 5 effects on the human body. One, it opens up blood vessels, increase circulation and remove waste. It vibrates water molecules. It causes the mitochondria to increase in energy, and inflammatory cells, which are hyperactive, they normalize it, they make it normal, so they reduce it. And lastly, they can activate DNA for repair. This is a big thing nowadays as far as cancer is concerned. We talk about it in the later slide. So this shows the characteristic of TeraHeartz in opening up blood vessels. And in opening up blood vessels, oxygen and nutrients leave the capillary to the tissue, and in the vein, all the waste products, carbon dioxide, go in here. So by opening up the blood vessels, it causes not only deliver the nutrients, not only deliver whatever the cells need, but it removes, it removes all the toxins, all the bad stuff, all the waste products from the cell. Okay? Then it regulates inflammation. These are inflammatory cells, the white blood cells in the blood. It looks like that under the microscope. And it regulates the activity by making them more normal. So that's the effect on inflammatory cells. And so therefore it's useful for diseases that has inflammation as one of its characteristics, such as heart attacks, a lot of autoimmune disease. Then it activates normal cell. It can influence the mitochondria. It causes mitochondria to produce more energy molecules called ATP. It's the energy pathway. It causes transport to place. That means the mitochondria can be active because of things being brought in and things being excreted, things like that. You see? So metabolism takes place, synthesis takes place, gene expression, that means DNA are translated into making actual protein or whatever molecule that is needed. Signaling takes place. Waste products like apoptosis are removed. And so forth. So a lot of activity takes place in the cell, in the mitochondria, as you know. So that's where it is. So besides activating everything, apoptosis also takes place. What is apoptosis? Apoptosis is when a cell has reached the end of its lifespan, it becomes not so useful. So the cell will die. And when it dies, it produces fragments that sends out signals, find me, eat me. And so when they are released, phagocytic cells will engulf all these fragments. And destroy them and degrade them so that they can be recycled. So it's very useful because in a sense it detoxes your body. Then it sterilizes the body from all kinds of organisms, bacteria, viruses, fungus, and so forth. All kinds of organisms, TeraHeartz can kill them, so remove them. That's how I discovered TeraHeartz. It was during COVID, when I saw a trial where people with COVID, they were sweeping it with infrared, what they call low laser light, which is actually infrared wave, and they get better. And that's how I got interested, because it can sterilizes the viruses that cause, and by extension we now know that it can do lots more besides that. So it activates DNA, and DNA usually occurs in double strand called a double helix. So when it's in a double helix, it's inactive. So DNA are active for two reasons. When you want to duplicate them, you want to make another strand of DNA, or make another cell, you're going to duplicate. To duplicate, you're going to open up, then you can synthesize another helix within it. The second reason why you need to open up the zip is when you need to do all kinds of things. For example, you want to synthesize molecule. Let's say this is a message to make a particular molecule, albumin or immunoglobulin. So you have an RNA that can read it, and then it will send a message to the mitochondria, which read kind of the recipe and make a protein molecule. So all the information the body needs to maintain the body are in the DNA, and that's how we make it available. So when you activate the DNA, you actually stimulate the body's natural processes, and that's how a lot of the healing takes place because of activity of TeraHeartz. So let's apply all these things to the developmental disorders, and as I say, we will concentrate on ADHD, autistic learning and perceptual disorders, and Tourette syndrome. Let's talk about ADHD. You know people with ADHD? You know, huh? So predominantly they are either inattentive or they are impulsive, hyperactive. So sometimes both. About 5% of young people are affected, and adults is about the same kind of thing. Usually more males than females are affected, although in the past it was not detected in females because females tend to be inattentive. So you don't notice them. Boys tend to be hyperactive, and you notice them because they're all over the place. So those, because they're only inattentive, they are not detected early. Of course, now we are aware of this, and more girls are being detected. So what are the symptoms like? Well, inattentive, easily distracted, makes careless mistakes, forgetful, losing things, unable to stick to tasks, unable to listen, carry out instruction, can't organize. Hyperactive, can't sit still, very fidgety, talk a lot, move a lot, can't wait for their turn, can't concentrate, act without thinking, impulsive, interrupts the conversation, no sense of danger. They can dash anywhere, and that's what happens. So these are the symptoms that you see, and of course sometimes when it's excessive, even if it's inattention, they can't perform things, they can't remember, it becomes very new, and that's how such cases are detected. So these are some of the things: forgetfulness, carelessness, risky behavior, or difficulty sitting still, daydreaming. In girls, distracted, cry easily, talk too much, cannot complete tasks, daydreaming, flirting, interrupting other people. The brain has a smaller brain volume, okay, and you can see much smaller. Even here, the cerebellum, which about balance, is small. So for normal human beings to function in the world, your frontal lobe is very important, because that's the part that organizes things in a very intellectual or in a way that it makes sense. So when this is gone, maybe that's why you have all this thing. So it affects the brain in two ways: impair neurotransmitter function. The neurotransmitter involved, a lot of it is dopamine. Abnormal brain structure, delayed brain development, and reduced cortical activation. The activation from the cortex, from the brain that controls our higher functions, as we call it. So that is what happened in ADHD. This is a video. Frontal lobe has all these functions, forgetfulness, because the connections are not there. So this neurotransmitter is involved in movement, sleep, attention, and learning. So parents are helpless. They don't know what to do. See a doctor, and that's where we get to diagnose and treat them. Now, what happened to the ADHD children who grow into adults? They're careless. They don't pay attention to details. Poor organizational skill. Always start new things, but can't finish the whole task. They can't prioritize or focus. Always misplacing things. Forgetful, restlessness. Extreme impatience, can't keep quiet, mood swings, irritability, cope poorly, can be quite successful. You know one famous person who is ADHD? You will never suspect. Albert Einstein, the famous scientist. Albert Einstein was said to be forgetful, can't remember things, and he was said to be disorganized, which are symptoms of ADHD. And in the course of my time, I've come across ADHD in adults. I've treated an adult who is a CEO of a large company. I've seen ADHD in trainers, people who do training, conduct workshops and things like that. So they can be successful. They'll be in jobs that don't require them to sit still in the office. They can't sit still in the office. They must take jobs that allows them to go out, and do things. So the important thing to remember is ADHD is due to genetic. It runs in families. If you have an ADHD child, chances are that parents and siblings are ADHD themselves. They may not be detected to find them. Always you find that the case. 27 ADHD genes have been identified. 76 as risk. That means when it's present, the risk is high. Most of the genes are related to dopamine metabolism. So the heritability of ADHD is 80%. That means there's an 80% chance if you have ADHD that your children will have it. Risk genes for ADHD. Now, some of the genes make you at risk for ADHD as well as autistic spectrum. That means there's some overlap here, and the overlap is quite a lot since there are about 200 over genes that's involved. And if the mother is ADHD, and I know of somebody, first I noticed that the child was ADHD. Then when I observed the parents carefully, it was the mother who was ADHD. ADHD mother also can risk having a child who is autistic more often than not. So the genes for ASD, autistic spectrum, and ADHD overlap, and so occurring together is not uncommon. You see that quite often the time. So what do? Actually, only thing you can do is medication that increase the level of dopamine. Stimulant, methylphenidate, Ritalin, Concerta has all been invented to treat ADHD. And all these different medication have different characteristics. There's a short-acting one, and there's one that's longer acting, up to even 12 hours. So depending on the symptom, if they need to go to school and learn, and that's within 6 hours, you give a short-acting one. If they need to be paying attention right throughout the day, then you give a long-acting one. And oftentimes I will combine a short-acting one and a long-acting one. The short-acting one make them able to pay attention in the first few hours, and then the long-acting one kicks in, and it's amazing what this medication can do, because when you take them, you actually calm down. So I can think of several of children who have been treated by me. When they were on the proper medication, they become normal, and then parents felt really good because at last their child was all over the place and they get angry at them. Suddenly they become human, so to speak. They can have a normal parent-child relationship with them because they will calm down. It makes a lot of difference. So what happened if you don't treat them? Even if you treat them, this is what happens in adults. Relationship problems, can't hold on to a job, anxiety, low self-esteem, can't finish tasks, difficulty sitting still when they come to work, trouble listening during conversation, become bored, take a long time to complete. So it does happen, and in the workplace sometimes you can see a colleague like that, and they probably ADHD in adult. However, there are people around who says, no, we don't want to take medicine. I respect, but they must know that if it's ADHD, it interferes with a lot of things. It interferes with relationships. It interferes with their achievement in life. In a marriage, with one being ADHD, if you don't do anything, it can lead to a divorce. Amazing thing is that hyperactive children attracts discipline and punishment. Imagine a boy running around, uncontrollable. The natural tendency for the parent is that they will cane, they will discipline them. And not only that, when you have a child that is out of control, being a mother or a father, you're stressed by the child until you go burn out. So if the child is being physically disciplined to the point where they was just punished indiscriminately, the child will develop post-traumatic stress and end up with a borderline personality, right? And indeed, I've seen such things. I once saw a mother who brought a child to see me to confirm whether ADHD, and she'd been resisting seeing a doctor for many years. When they saw me, it was quite obviously that the mother was stressed and burned out. You can see it on her face, written all over her face. She was stressed by her child. The child appeared to be having post-traumatic stress. The child was not only hyperactive from the ADHD, but hyperactive from the fact that they are being punished all the time until they are restless. So I told her, I said, look, you are suffering, your child is suffering, consider medication. She still said no, I don't believe in medication. But if medication can bring your child back to normal and you can have a good mother-child relationship, would you not do it? No. I hope after she saw me, she make a choice to want to have medication and get it sorted out. Because with this kind of history, eventually her child runs the risk of being arrested for crime, convicted and jailed. And we know that at one time the prison service do a psychological study of prisoners. Who are the prisoners we have in jail? They thought they will find people who are unintelligent. What they discovered was a lot of the prisoners were very intelligent. That's one surprise. Secondly, there were a lot of this kind of thing. So my take on this is that one way of getting your child back to normal, if there is a way to do it, bring your child there. Yeah, sometimes medication have side. I show you how many medication, at least 3. How many formulations? Probably more than 3. There will be always a formulation that's suitable. See? And when you consider the number of children who have side effects to almost every one of the medication, very small percentage, very small percentage. See? So it doesn't make sense to avoid medication. So what has this got to do with TeraHeartz? We are supposed to have a talk on TeraHeartz, right? Let's consider untreated ADHD. What happened? Risky behavior, gambling, traffic accidents, health issues, obesity, smoking, illegal drugs, sexual behavior, pregnancy, sexually transmitted disease, academic problems, dropping out, poor grades. What TeraHeartz can do? ADHD individuals are sensitive to light and heat. That's true, but it doesn't mean that light and heat cannot help. TeraHeartz has a calming effect. If you blow TeraHeartz, you will discover that it calms you down. It makes you less anxious. And TeraHeartz, we know, has a positive effect on mood and depression. More important, TeraHeartz raises the level of norepinephrine. And norepinephrine is one thing that is very depleted in ADHD because of the hyperactivity. It stimulates the growth of myelin, which makes the nerve function better, and activates brain-derived neurotropic factor, which causes the nerve to reproduce. It helps body to detox and eliminate heavy metals. Heavy metals has been said to be one of the causes of ADHD as well as other things, and it improves quality of sleep, which is of course a problem with ADHD. So it has helped. And when I look for testimonies of people with ADHD who use this one, they have testified that this helps. So take the medication and use this to help to make it even better. In fact, if this has a great effect, you can reduce the dose of medication. This is what I believe in, that we should take medication and if possible reduce the dosage and therefore reduce the side effect, right? So much for ADHD. Autistic spectrum disorders, this is becoming more commonly seen. It appears that there are more and more autistics nowadays. Not true. Why I say not true is because in the past, autism was defined very narrowly. So very few people qualify as autism. Nowadays, as we understand more and more of autism, the basket has broadened. So more and more people are diagnosed as autistics, which in the past has not been diagnosed as autistics. So because of that, that's why there appear to be more autistic nowadays. Of course, there's somebody, I think 20, 30 years ago in the UK, which claimed that autism is a result of poisoning by the vaccines. So it spread throughout the Western world, and their parents said, don't want vaccination. Oh my goodness. When you don't vaccine, you know what the vaccine protects you against? Smallpox, polio, and all these things. All these things will go up. But still, it's not true. That has been scientifically investigated and it was not true. And the doctor who was started this rumor has been punished for making fraudulent claim. I'm not sure whether he was jailed, but I think he deserved to be in jail because it's not true. Okay, so what's so special about autistic disorder? Well, they have problems with communication and interact, cannot relate to people. They have repetitive behaviors which is a way of avoiding people. So if I avoid talking with you, then I restrict my attention to things that I'm comfortable with. So there are unusual ways of learning, moving, and playing, and there's a wide variety of. So in autistic spectrum now we recognize 3 different groups. There's a group called the high functioning. 10, 20 years ago we used to call it Asperger's syndrome. It is not called Asperger's syndrome now, but I will still use a term so that it is more clearly defined. Asperger's syndrome often have high IQ. And if you read about autistics who become successful and become professors and all that, they're in this group. So they can have high IQ, they can be successful in life. Classical autism associated with mental handicap. So those very low IQ are what we call the classical autistics. In the past, only this group is considered to be autistic. So that's why when we widen it to include things like Asperger's, looks like more and more autistics around. No, it's that the basket is now being made bigger. Okay, so classical autism has a low IQ. In fact, you can divide autism into 3 groups by the IQ assessment. The high IQ, Asperger's syndrome, the low IQ, very low mental handicap, classical autism, and in between, majority by a name called PDD, pervasive developmental disorder. As adults, 14% married at one time, either now or in the past. 32% have romantic partners. Australian employment, only 15% are employed. A lot of them are self-employed. That's because they can't relate, they can't work enough. But with IT nowadays, IT coding, right? Repetitive, right? Autistics are very good. So they are very good for IT jobs. And in fact, they did very well in IT because they focus on the same things all the time, repetitive. They don't like interaction, they don't like to play with other people. So their productiveness in IT is very high. So if you are running an IT company, you will love autistics because they are the people who give you the best value for money in terms of work. So ASD has a certain look, When you look at somebody, you can say, this is normal. Why? There's an unusual look about them. Broad upper face, wider eyes, big mouth, walk on tiptoes. Have you seen children walk on tiptoes? Said to be due to vestibular. Vestibular means the balance sense. The balance sense is not in order. That's why they walk. Their language skills are limited. They talk at great length. These are the high functional autistics, the Asperger's. When they are verbal, they use words literally. They talk like very profound, but when you analyze the word sometimes, it's more like what they call semi-profundity. Or if you want to use something like verbal diarrhea. A lot of words, but they don't quite connect. Not quite intelligible as a great philosopher is. So because they have problems in relating socially, okay? So they also misunderstand things socially. So they misunderstand the context. For example, if there's aircon is more powerful in this place. If somebody say, I feel cold, it could mean many things, isn't it? It could mean I want to turn the aircon on. It could mean, could I have your jacket to keep me warm? It could mean so many things, isn't it? It could mean maybe we should go out. Let's go out somewhere. This room is so cold. So the same sentence can have different meanings depending on the context. Autistics cannot figure out the context. Are you listening to me? You can say in different tones of voice and it means different things depending on the context, right? Autistics can't figure out the change. So a lot of times there's misunderstanding when you talk to them. And then some autistics, monotone voice, flat voice, no humor, no emotion. So when you talk to autistic, you can straight away sense that this guy, no connection. You talk, but somehow it doesn't connect. So that's autistic. Reject cuddles, not responding, can't tolerate sounds, hyperactive, spin object, tiptoeing, sleep problems, epilepsy, hysterical, depression. So autistics, when they play, they avoid playing toys with a face. In other words, human-like toys. They play with toys that are more object-like, like blocks of wood or toy cars. And they tend to lay out things in a straight line. All the different cars or trains, all in a straight line. Sameness. So there are three functional. ASD, highest level, requiring some support. They need help in social interaction, organization and planning. Classical autism, low IQ, they need a lot of help, substantial support. Majority of autistics is in here. Narrow special interest, repetitive behavior. And of course, it can occur with other, can be associated with other problems from OCD to attention deficit to depression, all kinds of things. Because it's to do with genes, you see, and genetic causation doesn't mean that the body just produces this gene to have this disorder. The gene may be involved in a lot of functions that cause a person to have other disorders. And of course, tiptoe. So classical autism, the severe type, the low IQ type, they can't use spoken language. They're sensitive to bright lights, crowds, noise, and they have these flapping hands. They tend to rock and they flick their fingers. And these are called stimming, repetitive behavior, stimming. And this kind of behavior, when it's too excessive, they can't cope. They'll just simply run away. They get out of this situation, and that's what they tend to do. And when they can't cope with the excessive stimulation from the environment, after they do some stimming, they have what they call meltdown. Meltdown, throat temper tantrum. But unlike temper tantrum always there's a cause. There's something that provoked it. Meltdowns, have no cause. It's just that they feel that it's overwhelming, and then they have a meltdown. They throw a temper tantrum, cry and everything, but there's no cause to it. And so there's a tendency to self-injury. This is severe. So usually they arrange things and they maintain a certain posture, repeat movements of the body. So they may be associated with insomnia and epilepsy. Repetitive movement, rocking, door slamming, low IQ, they cannot tolerate sound, and very hard to engage that. So can't use spoken language, sensitivity to noise, crowd, everything. So Majority of autistic are what is called pervasive developmental disorder. That means developmentally they are backward, pervasive in that it covers a lot of behaviors. So they have a problem with language, their IQ is normal, they have difficulty relating to people, they tend to relate to objects. There were different modes of playing. Normal children, you will discover they have what is known as pretend play. They pretend that this toy is somebody. They pretend they see the mother look after them. They pretend they act like the mother. They pretend the toy is a child, and they play the kind of games like pretending. You don't see such play behavior. So changes in routine, changes in the surrounding cause a lot of stress to autistic, and of course the typical repetitive body movement. So that's where you are. Basically the same thing. Difficulty learning, strict adherence to routine, fixated with certain objects. They don't like being touched. React to certain smiles, repetitive action. See, they lay, times like that. You see, some parents notice this and say, then they begin to wonder, and that's when they suspect it. So socially, they are isolated. This shows that these are the three domains of behavior: the social behavior, communication, as well as behavior with regard to themselves, focus on objects and so forth. Autism, classical autism is a small portion. Asperger's is this, but the majority is pervasive developmental. So the three categories of autism is reflected in this diagram here. Okay, so Asperger's, normal to very high IQ, can speak, write, live independently. They have difficulties with social interaction and communication. When stressed, they shut down. They just can't cope. They speak fluently, but the use of language, like I said just now, can be abnormal, and they don't make eye contact or they don't engage in small talk. They rather not talk to anybody. So they are extremely devoted to routine and order, and they keep on repeating their restricted behavior. See, but they are very good to pay attention to detail. They can focus very well and they can persist. That's why they make very good IT workers. They're sensitive to noise, odors, all these things. They're prone to anxiety, depression, clumsiness. If routines change, they can't handle, and they have difficulty finishing tasks. So basically, Asperger's syndrome, they can laugh unnecessarily. They don't respond even if they're loud noise. They have no fear, no interaction. They echo words. They have attachment to objects. They like which they connect. They don't connect with people, and often they are. How about genetics of it? It's an epigenetic disorder. In other words, it's due to genes, but it's due to what is known as the expression of genes. The genes that are involved are the ones that switch on or switch off other genes. So about 100 genes have been identified, and these are genes that are concerned with communication and expression of other genes. Some special conditions like Fragile X on the X chromosome or Rett syndrome. Others are due to mutation. Mutation is when your cells divide. Sometimes a piece can be broken out. It's called deletion. Sometimes a fragment get repeated. So a fragment, say between this chromosome and that chromosome, instead of being copied once, get copied twice. So these are called duplicates. So deletions and duplicates occur as mutation. So it tends to run in families. I've seen one parent autistic or both parents autistic and children also autistic. More males than female. Heritability is about 80 to 90%. It's much more than, and a lot of people say that heavy metal poison is associated with that. But ADHD, no cure, no standard treatment. The most you can do is to use behavior and communication strategy. ABA is, or applied behavior analysis, has been quite effective. It's very strictly known as operant conditioning. If you know behavioral principles, ABA is operant conditioning. So educational therapies, remedial teachers should be involved. Medication is indicated if it's epilepsy or when they're depressed. Social anxiety can be reduced with mood disorders. I've treated several Asperger's, and certain mood stabilizers and antidepressants can be effective. One of the Asperger I treated, he went to Australia to study, and he was taking a mood stabilizer that helps him to connect with people and be social. Then he stopped his medication, and to his horror, his anxiety went up. He can't relate socially, so he called his father, please go and get some more medication from so and so. So I found out that the boy could not relate socially, and so he needed that mood stabilizer to calm his anxiety so that he can connect with his friends. So medication where indicated can be useful, but there's no medication that can cure autism. TeraHeartz has a very good benefit, like ADHD. So it tends to make ADHD more calm. It tends to make autism not to be so affected by their mood and their depression. So it makes them more available for normal interaction, and therefore TeraHeartz can be used. The heat suits the autistic, and if heavy metals are involved, TeraHeartz can release heavy metals in fat cells because of their detox effect, increase blood flow. So also reduce the buildup of lactic acid, which is said to make it worse. Reduce anxiety, improve sleep, because sleep is a problem with Crohn's disease. And apart from the heat, the frequency, reduce stress, improve mood, enhance creativity, communication, and problem solving. So it is helpful. Again, I've seen testimonies of how autism helps. So improvement in speech ability and social interaction, and enhanced memory and learning. And this is believed to be due to the release of nitric oxide caused by TeraHeartz. TeraHeartz has the ability to release nitric oxide in the body, and this causes learning as well as memory. So TeraHeartz is very useful once you understand what it can do. Learning disorder, this is a big topic. The 7 types of learning disorder: specific learning retardation or word recognition, difficulty with writing, difficulty with numbers, concepts, auditory processing, language processing, non-verbal processing body language, visual perception, Erlen syndrome, they can't process visual information. I will talk only on 2. And the reason I will explain why. We'll talk about dyslexia because this is most commonly seen. And in Singapore, Lee Kuan Yew said that he's dyslexic, isn't it? It turned out that his daughter was also. So the doctor recognized it, said, get yourself tested. So he got the professor to test. And then he admitted in a talk that he was dyslexic and his daughter was also. Which tells you that being dyslexic is not a barrier. I know of some relatives who are dyslexic, and one is an accountant. So in spite of his dyslexia, he can become an accountant. Of course, accountant deal with figures, but dyslexic, although they have a difficulty with words as in the left hemisphere. The right hemisphere is very good. The right hemisphere deals with visual. They can see things and concrete. So dyslexic makes very good engineers because they are good with mathematics, concepts and all that, not with words. So what's dyslexia like? They're late talking, reading below expectation, and reading difficulty reading aloud. They can't spell, they see differences in letters and words. So they have this problem throughout life where they form words incorrectly, reversing sounds. So B and D, they see they're similar. So they often reverse the B and D and the P's and the Q's. It's a reverse mirror image, we call that. They can't remember sequence, they mispronounce name, they have difficulty processing or understanding. Third, their strength is visual spatial tasks, creativity, problem solving. So they're very good artists, they're very good chefs, they're very good engineers, create things. So that's what dyslexia is. These are actually normal words, but this is what the dyslexic sees. They see all the words all spread out. They see the words like that. So individuals with dyslexic have this difficulty in reading, spelling, writing, and pronouncing, but they have normal to above average intelligence. They're gifted in art, music, maths, and sports. So explicit, systematic, cumulative instructions design, and remedial teachers who specialize in dealing with dyslexic often make use of their strength to help them to read effectively. So this is an interesting disorder because a lot of people have them without realizing, and oftentimes they're successful. They go into occupation. They don't require the use of language. So all these things, engineering, sports, math, all these things like creative, any of the creative disciplines, chances are that visual perceptual disorder, Erlen syndrome. I come to know of this syndrome because there's a psychologist in Singapore who specializes in this. When I know of it, I interacted a bit with her, and she has big available skills to help a lot of children in schools and all. I thought it was good of her to be able to do that. They have this ability to make sense of visual information. So they have trouble copying, they can't detect differences in shape, and they have a hard time distinguishing shape, letters and sequence, troubling where they have trouble understanding where objects are in space, and sometimes Erlen syndrome describes the letters floating, coming out of the page. that kind of a thing. So that's what they see. Imagine you try to read, impossible. And by giving them special glasses, they can see normally. Glasses kind of correct the misperception. Isn't it amazing? So that's what happens. And that's why they struggle to read. You give them a page, they cannot read. They have difficulty. Then the normal reaction of parents is, how come you can't read correctly? Punish them. The more you punish, the worse it becomes. They see the whole thing going round. Or even worse, they just float about. This is what they actually see. And so if you are aware of any children with these kind of problems, get them assessed, get them tested so that we can do something about it. Learning disorders run in families. I know of fathers who are dyslexic like Lee Kuan Yew and then the daughter, or even the son dyslexic. Very common. 40% of siblings, 49% of parents affected. Inheritability range from 40% to 80%. There are 42 genetic variants, I mean genetic things. So 15 brain express genes, 15 different genes which affect expression. That means these are gene switches. You see, autism also we say due to this, right? The gene switches. For a gene to work, the gene must be switched on and switched off. It's been shown that we have the genes that a lot of animals, including birds, have. Why we don't grow up to be like birds? For example, our hands like the birds, like the chicken wing like that. Why? Because certain genes are switched off, certain genes on. So that's what we mean. So on chromosome 6 linked to learning disorder. And it's interesting, if one parent is affected, there's a 50% chance of dyslexia in the offspring. Both parents are affected, 100. So clearly a genetic disorder. And that's why it's important. And because when you grow up into adults, you still have this problem. So how do you deal with it? You need to assess properly, neurological testing, psychological evaluation, tests for reading and other academic skills. And if it's true dyslexia, there's no way you can do anything about it. There's no way to correct it. So you need special educational intervention, special techniques, including modifying the hearing or the vision with special glasses and special tutoring sessions with reading specialists. My son used with some problems in learning, and they were sent to a remedial specialist who taught him strategies to be able to read see correctly. So he's now doing very well in IT. So you can overcome it. How about dyslexia and TeraHeartz? Now, there are testimonies, as I say, of people who have blown their autistic or the ADHD children with it. But so far, I could not find any report on dyslexia. Maybe people think that this is learning and so nothing to do with TeraHeartz. But I have a feeling that TeraHeartz. Why? Because TeraHeartz promotes nerve regeneration and repair. TeraHeartz effect on mitochondrial function. TeraHeartz improve emotional and cognitive function. And remember, in the slide in autism, what did I say? It affects memory and cognition, right? So it should affect TeraHeartz induce improved cognitive function and memory. And this is in a research study of Alzheimer's induced mice. You induce the changes of Alzheimer's in mice to study what can be done, and they found that TeraHeartz improves cognition. So theoretically, TeraHeartz will have a positive effect on dyslexia, except that maybe nobody has yet tried, or they have tried it but they didn't report theirs in a testimony on our website or Facebook page. If there is, please let me know. I am not aware, but I look for that I could find. So it must have a positive effect on learning, strictly speaking. And just before I come, I was reading a paper on TeraHeartz on the nervous system. It says TeraHeartz has a positive effect on the nervous system because the nervous system is full of nerve impulses, which are electrical discharges, right? TeraHeartz should have influence, and it has a positive influence on many nervous function, including memory and cognitive function, which is affected in learning disorders. But remember, educational remediation is still very important. So how they are handled? Educational programs teach them to make use of multisensory methods, assisted learning, reading and spelling technique to overcome it. Use word games, training, counseling. So as a child gets older, it can look like that. They don't like to read aloud in class. They confuse letters with similar shapes, mixing up the position of sounds in the word. Animal become amino, that kind of things. Difficulty spelling simple words. Yes, you see them. Sometimes in interaction, you find people, they can't do this thing. And they're probably dyslexic as children and now as adults. Gilles de la Tourette, shortening to Tourette syndrome for short. Last time people say, oh, this is a case of Gilles. But now people commonly use it as Tourette syndrome. It's a motor disorder involving muscle. And both sexes are affected, normal IQ. Vocal or motor tics. A tic is movement of a particular muscle. Motor tics are rapid, repetitive, irregular, brief, and controlled motion. What are motions? Blinking, eye rolling, grimacing, shrugging, jerking, okay, jerk the head, you see, twirling, touching objects, touch other people sometimes, or touch themselves. Vocal sticks, that means the muscle move to do with the voice production, and they can sniff, they can yap, they can complex repetitive syllables, phrases. Echolalia, they repeat what you say. Palalia, they repeat some things. Coprolalia is the worst. Coprolalia is when they repeat obscenities. Right? All 4-letter words, obscenities, they repeat it, coprolalia. And it's very embarrassing if they are coprolalia. 40% remit completely. That means after about some years, they disappear. Majority, they have reduced symptoms in life. And sometimes adults, you find they have repetitive movements of the hands or something. So this is tourist. And occasionally you find people, especially in buses, they have vocal tics. They make sentences out involuntarily, repetitively. That is Tourette syndrome as adult. So they persist into adult life, but not so bad as child. As long as it's not coprolalia, which is probably the worst, because if you're saying 4-letter words, you offend a lot of people. Or if you just move your shoulder or move parts of your body or just vocalize some sounds repetitive, people are not so bothered. So it's linked up to a lot of other syndromes because it's a nervous disorder, particularly with OCD. Obsessive compulsive disorder. So motor tics, movements, vocal tic, close the door, close the door, close the door, repeat. So there you are. Grimacing, swear words. So these are the symptoms of Tourette syndrome. Appear to be autosomal dominant. That means if one parent gets it, then offspring have 50% chance of getting it. Estimate to be of 53%. Genes involved to do with dopamine and serotonin as well as mitochondrial support. And these genes were identified in chromosomes 13. If a mother smoked or coffee, alcohol and stress during her pregnancy, appear to trigger off Tourette. So the genetic etiology is quite complex because we have not quite exactly figured out. So research is still on. There's no cure, symptomatic treatment. If the tics are terrible, we use medication to control it. So there are a lot of behavioral techniques that we can use. Awareness training, competing response, biofeedback. Awareness training means make the person aware that they are doing it, their movements or their vocal tics. And competing response is help them to formulate a response that compete with the tic, so then they can choose to have this other response rather than the tic. Biofeedback means you make them aware of what is happening to their body by wiring them up to a sensor, and then they try and use a sensor to guide them to reduce the tic. There's a behavioral intervention called CBIT, cognitive behavioral intervention for tic. Psychotherapy can be used for secondary social or emotional problems. And then if there are other problems such as ADHD, depression, anxiety, OCD, that's what we do. Again, like dyslexia, there are no reports of anybody using TeraHeartz on Tourette. I suppose some of the tics are obnoxious and socially undesirable, so people are not likely to report. Maybe, but if there are reports of dyslexia or Tourette syndrome with TeraHeartz, I'll be very interested to know. There's no reason why Tourette syndrome doesn't respond. But I like to say a little bit about these developmental disorders because they are quite common. You see them just going around. Now that I mention it, you can look back and say, hey, yeah, I see this person with the tics, or I see this person very awkward, or I see this person, the way he talks is abnormal. The important thing to remember is that developmental disorders do respond, because as the paper I read this morning says, the nervous system is full of electrical impulses, and it's impossible for terrorists not to be able to influence the impulses of the nerves. But it is very important that we get treatment from licensed professional treatment and management that is accepted safely. I think this is terribly, I think it'll be very foolhardy to have any condition, whatever it is, and to say, oh, this is a cure. No, this is not. Number one, it's not validated unless you're a doctor and you can make a proper diagnosis. I can order the appropriate tests to confirm your diagnosis. Is not validated. I know that there are people who set up treatment centers using TeraHeartz. I mean, if you are a doctor or physiotherapist or a professional, you are licensed and governed by that society or that professional body. Good. That's your accountability. When things go wrong, you know what to do because you're a professional. But if you are not a professional and you use this as a set of treatment center, I think that is wrong because there's no accountability. I think that must be said because this thing is sold as a self-help device, and particularly in developmental disorders, they have genetic causes. Genetic causes means one thing: neurochemistry and neurophysiology is involved. So like autism, there's no cure for this because it's genetic. But we know what can help. If the autistic have other problems, behavioral problems, we know that certain medication will help because they have been studied by medical doctors, child psychiatrists, child psychologists, or whatever. As I mentioned, the social problems of autistic can be managed by mood stabilizers and antidepressants, which make them able to be present, to overcome their dysfunction and become normal again. There's accountability. So TeraHeartz should be used adjunctive treatment. TeraHeartz is in no way a medical treatment in that sense. It's self-help. After you get the medical treatment, after you get the appropriate help from remedial teachers or remedial psychologists, by all means use TeraHeartz to improve on it, make it better. I strongly advocate that. But not to consult any professional and use that as treatment, I think is not correct. Remember, professional grade equipment, when you shine at TeraHeartz, that's why it's very concentrated. High powered, it is consistent, all of the same wavelength, and all synchronized. That means all the waves are synchronized, all the peaks and the throats are synchronized. So it's very concentrated, a lot of energy penetration is created. For this, you require training. TeraHeartz is something like there's a spread. It's not that narrowly focused, so it's for self-help. No training required. Somebody put up this advertisement. iTeraCare device and its benefit your personal doctor. I strike out the doctor. Your personal health assistant more likely. It helps, but to see it as a doctor would not be correct. So TeraHeartz can repair, and certainly we know that TeraHeartz can repair a lot of things. I myself have TeraHeartz to cause a lot of my dislocations and whatever to be repaired totally. You can do it, but always remember it's self-help for inflammation, for pain, for blockages, and for skin. Very effective in this.
Doctor one no more.
And not recommended for this. Although the official teaching is that you cannot use for open wounds, I disagree because there have been more than one papers where TeraHeartz have improved open wounds. So for that reason, yeah, we can use it for open. And that's interesting because it shows the effectiveness of TeraHeartz to heal even though the wound